But it was because they had faith in us, because we told them the truth. And we said what we know and what we didn't know. And so that's what we need to do here. We need to just have straight talk. Don't tell them it's low risk. That's like the hurricane, okay? I would be really mad at you if I thought you were a hurricane forecaster and you knew this was coming, but you kept telling me, oh, it's low risk, don't worry about it.
Right. Yeah, once it hit.
Yeah, so that's what we need to do today is just we are at risk. So even this situation as it unfolds, it's not just about what the virus does to you. It's about what the entire system is rigged up to be and what this virus does once it gets into it.
Jesus. You're making me nervous.
Well, but that's before we get done here. We're going to talk about what we can do to get people not nervous, because this is
it's too late.
No. What I mean is we're going to bring you around to take. It's my job is not to scare you out of your wits; it's to scare you into your wits. She texted this to this employee of ours last night, and this was an email that came out yesterday from one of their physicians in Milan at the largest hospital there, and he said, "I just got a very disturbing message from a cardiologist at one of the Milan's largest hospitals. They're deciding who they have to let die. They aren't screening the staff anymore because they need all hands on deck, and they have very small areas of the hospital dedicated to non-COVID patients where they still screen doctors. Everybody else is dedicated to COVID patients, so even if they're positive, meaning that they're sick, but they don't have a severe cough or fever, then they have to work." He says that they're seeing an alarming number of cases in the 40-something age range, and these are horrible cases.
It seems like we're not really prepared for something like this, although the CDC's been telling us for a long time that we should be.
We are not prepared at all in the sense. I wrote the book, Deadliest Enemies, that was published in 2017.
Right
Thank
here,
you.
ladies and gentlemen.
Thank you.
Go get it.
No,
read it.
And
panic.
In chapter 13, the title of the chapter was SARS and MERS, a harbinger of things to come. We predicted this. And then I wrote a chapter on there what a flu pandemic would look like if it emerged in China. And if you read it, it's exactly what's happened. The supply chains went down. China locked down the country. It spread to other countries. People all pointed fingers. And, it's the kind of thing where we hear it, but we don't get prepared. 5 years ago, I gave a talk at the Mayo Clinic. First time I talked about this, I talked many times afterwards, and I showed a slide of Puerto Rico, a picture of Puerto Rico, and then I showed the map, and then I showed a picture of a building in Puerto Rico, a nondescript building, and I said, this is our next big disaster. It turns out that 85% of all the world's production of IV bags, the saline that we need desperately, were made in these plants in Puerto Rico. And all we needed was one Category 5 hurricane to come through and take it out. Maria came through a year and a half ago, and the world went into a major crisis with a shortage of IV bags. Now, that was so obvious that was going to happen, and yet we don't prepare.
That's so foolish.
I know, I agree. And that's what, hopefully this is a wake-up call. The business community, I hopefully will wake up. One of the other things we're doing right now, Joe, this is really one of the things that has me most concerned about this whole situation is our group has been studying for the last year and a half with support from the Walton Family Foundation, looking at critical drug shortages. It turns out that we identified 153 drugs in this country that people need right now or they die. I mean, it's on the crash card. It's acute critical drugs. 100% of them are generic. All of them basically are made offshore of the United States. And a large part of them are made in China and India. And at this point, we have shortages anyway every day, just before this crisis happened. Now these supply chains have gone down. Our group is actively helping the United States government try to figure out, where they're going to get these drugs. Now, just think of this. If I came to you and said the Defense Department was going to outsource all its munitions production to China, you'd look at me and say, come on. You know what? The U.S. Defense Department has no more access to these drugs than anybody else. They are beholden to China for these drugs. 690,000 Americans have end-stage renal disease right now. Most of their primary drugs are coming from China. And I'm so tired of having people say to me, if you tell them this stuff, they're going to panic. And I say, well, what's panic? Have you seen anybody riding in the streets yet? Have you seen cars turned over, smashed? Have you seen people hurting themselves over this issue? They're concerned, but they want legitimate information. And so what you need to do is just tell them the truth. And we have actually occurring over 480,000 deaths that can occur over the next 3 to 7 months with this situation. So this is not one that to take lightly. And I think that's what I can understand if you say there's only been 10 deaths or 20 deaths or 50 deaths. Just remember, 2 weeks ago, we were talking about almost no cases in the United States. And now that we're testing for it and watching the spread as it's unfolding, those numbers are going up astronomically. 3 weeks ago, Italy was just living life just fine. Now they're literally in a virtual shutdown in the northern parts of Italy. And that's the challenge with an infectious disease like this. It can spread very quickly, and it also can affect. It's so important because, Joe, we really have got to get information out to the public. There is so much misinformation right now. And, we're going to be in this for a while. This is not going to happen overnight. And I worry, I keep telling people we're handling this like it's a corona blizzard, 2 or 3 days, we're back to normal. This is a coronavirus winter. And we're going to have the next 3 months or more, 6 months or more, that are going to be like this. And, so far this thing has been unfolding exactly as we predicted it. We and our center put out a piece on January 20th and said this is going to spread worldwide. At the time, people said, no, it's just China. We put out a piece the first week of February and said this is going to pop probably the last week of February, first week of March, because what happens is it has what's called an R0, or a doubling time of these every 4 days. So it increases doubling every 4 days. So if you go from 2 to 4 to 8 to 16, it takes a while to build up. But when you start going from 500 to 1,000 to 2,000 to 4,000, that's what we're seeing happen in places like Italy. We're beginning to see it in some ways up in Seattle. It's what happened in China. And, when people are confronted with that, suddenly this low-risk phenomena that everybody talks about isn't so low anymore. And that's what we need to prepare people for, something that transmits very, very easily through the air. We now have data to show that you're infectious before you even get sick. And in some cases, quite highly infectious. Just breathing is all that you need to do. So from this perspective, I can understand why people would say, well, wait a minute, flu kills a lot more itself every year than this does. And I remind people this is just the beginning. Probably the best guesstimate we have right now on what limited data we have would say this is going to be at least 10 to 15 times worse than the worst seasonal flu. And I'll grant you it will hit, primarily the older population and those with underlying health problems. But as I mentioned also, we have a lot of people who have other risk factors. Obesity, high blood pressure is another risk factor where you can have a really bad outcome with this. And so we don't quite know what it's going to do yet. I think, we've been right on the mark predicting where it's going to be to today. I think from here on out, I can tell you it's going to stay around for months. It's not going to go away tomorrow. We got to stop thinking about, if we just get through tomorrow, that's it. So if we're going to close schools, we're going to tell people not to go into public, we're going to cancel big events. How long are we prepared to do that? What are we going to do? We have to ask ourselves that. The fatality rate now, it did preferentially impact 18 to 25-year-olds. They were the hardest hit group.
Yeah, why was that?
Well, it has to do with your immune response again. We think that what happened is when this virus got into you, it created what we call a cytokine storm, which is an antibody response in your body that's out of control. And it basically, you destroy yourself. And it sets this thing up to trigger it off.
So the healthier people had the more adverse reaction to it.
Exactly. Or the other group that has had a real challenge with that are pregnant women. And pregnant women have a very unique issue. One is, of course, they have some constriction of their lungs just by the very physical mass. But also their immune system is really at a heightened state at that point. There's a part of that immune system in that woman that says, this is not all me, get rid of this. It's like a rejection of a graft. And the other part saying, this is the most precious cargo I'll ever carry. I got to make sure I don't lose it. And when that virus got in between those two, it started, again, that same kind of cytokine storm. What's going to happen if you get enough people who get infected, ultimately, then it'll slow down and stop transmission that way, but that's a heck of a price to pay to get there. But I think the key message here is that, we're going to get through this, but right now we do have some real challenges before us. What we can't tell people is it's all safe. I every time I hear people say the risk is low right now, it reminds me of what would happen if there was this huge low-pressure system 5 days off the coast at the Gulf, and there was 90-degree water between that system and the beach, and there was no wind shears in the northern hemisphere that's likely going to knock it off. But we tell the people standing on the beach that day we have low risk of anything. Well, we know 5 days from now it's coming.
Right.
And so what we need to do is help this American population, or the world for that matter, understand we're going to be in some hurt for the next few months, and we have got to get better prepared. How are we going to work? Where are we going to work? We can't stop working. We need our lights on. We need health care.
Right.
We need food.
So a bunch of things people should do that's going to boost their immune system that we know of, right? Like get sleep, drastically lower your alcohol intake, drink a lot of water, take vitamins, those kind of things. Things that are going to keep your body healthy.
Yep, you nailed it.
So
and just keep healthy as you can. And then I think the other key piece, though, is if you do get the flu and you have really bad muscle aches, one of the things about real influenza is not just sniffles. You feel like you got hit by a Mack truck. If after several days you still are really feeling bad, really bad, and you haven't seen a physician by then, you should, because that's when you get the complications occurring, the bacterial pneumonias that occur subsequent. And if you get those treated earlier than later, you can actually do a lot to keep somebody from dying. So, if you don't feel a lot better in 2 days, I mean, if you catch it really early, you can get a medication for flu. There's actually a medication that will reduce your illness a bit. But if you're sick for more than a couple of days, not better, you absolutely should see a doctor so you don't have these other complications.
And what can a doctor do once you go
any family practitioner would know what to look for and whether or not your lungs are starting to fill up. If they'll listen to your lungs to make sure you're not developing pneumonia.
And what would they do for you?
They would likely give you an antibiotic based on what you had, because you are then the problem with flu is it's not just the flu virus, but then you get secondary bacterial pneumonia from the damage in the lungs, and so they can prevent that. A lot of older people in particular will die from actually what we call secondary pneumonia to having had influenza. They wouldn't have gotten the pneumonia if they had not had flu, but then they do as much as you can, and that's really about what we can do.
And limiting the contact, is that really going to help?
It does, because it's like putting rods in a reaction. If you don't have as much close contact, you can not transmit as much. If I'm sitting in a room with 100 people and we're kind of sharing air, the transmission's remarkable. Right here off the coast of California, you've got your cruise ship. Cruise ships are notorious for recirculating air inside the inner cabins. We've had a number of outbreaks.
That's why they're having these outbreaks on cruise ships?
And then you leave them on there. I think the cruelest human experiment we've done in a long time with humans is leave them on these ships. Get them off right away.
Should they get them off right away?
Oh, absolutely.
And what should they do with them?
Well, they can put them in quarantines of some kind if they want and follow up on them. But you're guaranteed they're all going to keep getting...